I said I was going to ask you what the current situation is like at IMaH in terms of COVID numbers.
As of 2 months ago, we had technically closed our COVID ward because the cases were more like mild, so we're seeing them through the OP, the outpatient department. But 2-3 weeks ago, we had an influx of COVID cases again, so we had to reopen the ward.
Right.
So currently, as I'm speaking, since 2 weeks, we've managed almost 30 inpatients.
Right.
So, and then right now we are realizing that there are more kids being affected than children. Previous waves, we had more, you'll see 1 or 2 kids, pediatrics coming. But of late, every week we have a pediatric case as young as two months.
Wow.
Yes, with COVID, very bad COVID infection. So we still keep on preaching to people the prevention methods. If you are an adult and you have a kid, you may wear the mask. You forget that the child was not wearing a mask, and they can get it. And usually, when kids are sick, it breaks everybody's heart. Like
Absolutely.
It's so disrupting. Yeah. So the COVID numbers have gone up again. We are seeing more cases of the COVID at the emergency, and then we are doing more COVID admissions.
Right. All right. So tell us attitude towards COVID. And now you can even see it. People are not adhering to the protocols, even though there's been a resurgence, there's been a surge in some places, and the Ghana Health Services on air, announcing that let's get back to the way we were when it first broke in 2020. But people seem not to budge.
I agree with you, but the thing is, how people have lived with it for 2 years. People are tired.
Yeah.
But in our facility, we still encourage hand washing, wearing your nose masks. All our clients, we encourage them to vaccinate or top up their vaccinations. If you already had one, those who've had 1, 2, we ask them to go for boosters. And all our clients with chronic illnesses, we follow up and make sure their vaccinations are up to date. Because if you're hypertensive, we don't need COVID coming into the situation to make things worse.
Yeah.
But with the national policy, it's only banks and other few institutions
No mask, no entry.
Yes, so
I wanted to ask you whether you think that it's a good thing we go back to it.
I think that would be the barest minimum, just nose masks.